Good morning. I want to thank our witnesses for appearing before the subcommittee today. In the next few years, as we continue to confront difficult spending choices, we really have to continue, in my view, to firmly establish our federal commitment to the National Institute of Health. Since its founding, the NIH has funded research to raise life expectancy, to lower healthcare costs, and to improve the quality of life for all Americans. In the 80 years since Congress established the National Cancer Institute, we've gone from really crude treatments with grim prognosis to a place where we know much more about what we're dealing with and how to deal with it. And we're going to hear today some future projections of how that even advances in a more dramatic way. Since the 1940s, the rate of cardiovascular deaths have dropped 60% thanks to effective treatments, a lot of which involved NIH-funded research. These are really two great examples, both in cancer and cardiovascular disease, of what happens when you have the kinds of medical breakthroughs that we've seen and I think can see in even greater numbers. In the past year, NIH funded the development of an artificial pancreas that would be life-changing if you have type 1 diabetes. They've discovered biomarkers that were unique to two different prostate cancer stages and decoded the structure of the Zika virus. We need to remember that this progress didn't occur on its own. It happened because of a generation of researchers funded largely by the U.S. government through the NIH tirelessly worked to discover the science that led to these treatments and cures. Federal funding was an essential component of that progress and has advanced the understanding of disease, raised life expectancy, and improved quality of life for patients and their families. Last year, for the first time in over a decade, the Labor HHS Appropriations Bill significantly increased funding for NIH. This $2 billion increase allowed the NIH to fund 1,147 more grants nationwide than they would have funded otherwise. Funding for NIH research in my home state is increased by $37.4 million, or 8%, as we saw just about that same size increase in overall NIH funding. Consistent, sustained increases in funding are critical for biomedical researchers as they undertake the complex multi-year studies necessary to pursue new treatments. It's also they're also essential if we're going to encourage young researchers, and we're going to hear some about that today as well, to really believe that they can and will be able to make a real difference in research. By the way, a pattern has to first happen in the second year. And I want to thank Senator Murray for her support and leadership as we, again, in the bill that's still pending before the Congress, work to add another $2 billion to the basic research funding at NIH. Fiscal year 2016 funding increase cannot and should not be seen as a one-time thing or even towards some goal that's anywhere short of funding research, as long as there's research that is promising to be funded. We do know that the scientific advances that will be made in the next 10 years can make a real difference in people's lives and make a real difference in overall healthcare costs. They'll make a real difference in taxpayer-funded healthcare costs, and we need to be committed in that regard. And certainly, Senator Murray has been, and we've been able to work together on this. And Senator Murray, I'd like to turn to you for your opening remarks.